Gestational diabetes. Something about gestational diabetes. Gestational diabetes is defined as hyperglycemia during pregnancy. In pregnancy, there is fetoplacental unit which is to send glucose and amino acid to the fetus from the mother. This fetoplacental unit causes some metabolic changes during pregnancy. These metabolic changes produces placental steroids, growth hormone variant, and placental lactogen. Besides production of these factors, insulin resistance, which is occurring during pregnancy, both causes hyperglycemia during pregnancy, which is known as gestational diabetes. All pregnant women should be screened for gestational diabetes unless they are in a low risk group. Low risk group are gestational diabetics who are less than 25 years old. Secondly, body mass index less than 25 kg per square meter. Third is no maternal history of microsomia or gestational diabetes. Fourth one is no diabetes in first degree relative. Complications of gestational diabetes are preeclampsia, macrosomia, birth lacerations. Fetus are at risk of hypoglycemia and birth trauma. In gestational diabetes, treatment of choice is insulin. Goal of glycemic control should be designed in physiologic insulin secretion pattern. Target of glycemic control reflected by glycosylated hemoglobin. In general, the target glycosylated hemoglobin should be less than 7%. The target glycosylated hemoglobin must be individualized to accommodate other considerations, other factors. Normal range of glycosylated hemoglobin is less than 6, goal is less than 7, and additional suggested is more than 8. Management goal is to attain euglycemia with all measures of control. One of the important steps is comprehensive recording of plasma glucose measurement and nutritional intake by patient. There are various kinds of insulin regimens: multiple component insulin regimens, multiple daily injections, and insulin infusion devices. Advantage of these insulin regimens are improved sense of well-being, greater flexibility in timing and contents of meals, and capability to alter insulin dosing with exercise. There are two types of insulin preparations: the short-acting insulin preparations and long-acting of insulin preparations. Short-acting insulin preparations, that is Lispro, is advantageous as duration of action also appears to be associated with decreased number of hypoglycemic attacks. Long-acting insulin preparation, Clargine, hasn't that advantage of like that of short-acting insulin. But in this case, there is little bit convenience in taking it. Although mixing of intermediate acting and short acting insulin formulation is present, is common in practice, this mixing may alter the insulin absorption profile. Lots of things about the insulin preparations and insulin regimens which I want to discuss, that I will try later on next time. Thanks. Gestational diabetes. Something about gestational diabetes. Gestational diabetes is defined as hyperglycemia during pregnancy. In pregnancy, there is